Heart failure versus heart attack. A 3D animation shows the difference. Every 5 minutes, 2 ambulances race to opposite ends of the city. One carries a patient whose heart muscle is choking from a sudden pipe blockage, the other a patient whose pump has quietly weakened for years. Same chest, same organ, 2 opposite emergencies. Think you know the difference? Stick around. By the end of this short ride inside the body, you'll know exactly which is which, and that knowledge could genuinely save a life. The healthy baseline. Before drama strikes, your heart is an incredible fist-sized pump, tirelessly beating 100,000 times a day. It's a masterpiece of efficiency. Deoxygenated blood, appearing blue in our animation, enters the right side, gets a quick lung refill, then blasts out the left side through powerful rhythmic squeezes. When every beat ejects 50+% of the blood inside, life feels effortless. But let one crucial pipe clog or the muscle itself tire, and the story flips fast. Heart attack, the clog. Now imagine diving deep inside a coronary artery. Over years, fatty streaks, known as plaque, begin to coat the artery wall like rust, slowly building up inside an old pipe. This process, called atherosclerosis, silently narrows the passageway. Then one day, the delicate cap over that plaque cracks. Suddenly, platelets rush in trying to fix the injury, and bam, a blood clot forms, completely damming the flow in seconds. Downstream, the heart muscle cells deprived of their vital oxygen supply scream for help. Without it, they start to die, roughly 1,000 cells with every single heartbeat. The pump keeps going, sure, but a dark, motionless patch spreads through the affected area. This is a plumbing crisis, not a power outage, and it demands immediate attention. Classic warning signs erupt: crushing chest pressure, pain radiating to the arm or jaw, sudden cold sweat, nausea. Interestingly, women often feel more breathlessness and fatigue alongside these symptoms. Reopening that blocked pipe within 90 minutes is absolutely critical to limit the scar tissue. Emergency crews use clot-busting drugs, balloons, stents, anything to restore that life-giving river of oxygen before the muscle turns to permanently damaged fibrous tissue. Now let's glide over to a completely different heart, one that has perhaps survived smaller attacks, struggled with high blood pressure for years, or battled faulty valves. This heart isn't suddenly blocked, it's just plain old worn out. Its walls have either ballooned and thinned, becoming flabby and inefficient, or they've stiffened like old, inflexible rubber. Either way, the ejection fraction, that measure of how much blood is pumped out with each beat, drops significantly. Instead of pushing out a healthy 50%, it might only manage 20%. What happens then? Blood backs up. Your lungs can flood with fluid, making breathing difficult. Your ankles swell, your legs feel heavy, and those midnight trips to the bathroom multiply. Where a heart attack hits like lightning, heart failure seeps in like a slow, persistent leak. People often pace themselves on stairs, stack pillows just to breathe comfortably at night, and sadly, often chalk up profound fatigue to simply getting old. This isn't a quick fix, it's a marathon. Medications like ACE inhibitors, beta blockers, and diuretics, plus low-salt diets, fluid limits, and sometimes even implantable devices, all aim to lighten the pump's load long-term, to help it manage, not to clear a sudden blockage. Side-by-side reality check. So, let's put it simply, we're talking about a sudden blockage versus a gradual chronic weakness. It's an artery drama versus muscle fatigue. One can definitely trigger the other. An attack scars tissue and paves the way for failure. Chronic failure can destabilize plaque and provoke attacks, but they demand fundamentally opposite first responses. Spot attack symptoms? Call emergency services immediately. Chew aspirin if advised, and race the clock. Every second counts. Spot failure symptoms, see your cardiologist, tweak your meds, and track your daily weight to catch fluid gain early.
Mixing them up wastes critical minutes and could have dire consequences. If this 3-minute tour just rewired your understanding of these vital differences, hit that subscribe button. More essential body trips drop every week, and you won't want to miss them. Gender and age curveballs. Here's where it gets tricky. Symptoms aren't always textbook. Women's heart attack pain often masquerades as indigestion, general fatigue, or even upper back pressure. So it's crucial to listen to those subtle, persistent signs. Diabetics, sadly, might feel nothing at all during an attack, a silent event only uncovered later on routine ECGs. For heart failure, the elderly often blame breathlessness on just getting old or lung issues. A young athlete might attribute their fatigue to deconditioning. The takeaway? Know your baseline numbers, blood pressure, cholesterol, and if you've ever had murmurs or scares, ask about your ejection fraction. And always ask for an ultrasound or further investigation when things just feel off. Your body talks, it's up to us to listen. Drop your questions below. We love hearing from you. And please give this video a share if you know someone who might be mixing up these terms. Tap the bell so you don't miss our next dive, where we'll tackle cardiac arrest versus stroke. Conclusion. Remember this: a heart attack starves muscle in minutes. Heart failure exhausts it over months, even years. One is a frantic sprint to reopen clogged pipes, the other a challenging marathon to lighten the pump's load. Understand the difference? Trust symptoms that don't quit and act early, because when it comes to your heart, it rarely gives second notices.